Hello, everyone, and welcome once again to your Wednesday night webinar brought to you by NoCD. NoCD, your favorite platform for obsessive compulsive disorder treatment. And I can't say enough awesomeness about how pleased I am with my team and the great work that they are doing. So, good job, team. Excellent work. Now, if you're looking for teletherapy, we have that available for you via the NoCD platform. Not only can you do teletherapy there, but you can get support between sessions, and you can finally reach out to someone who knows what OCD is and knows how to help people with OCD as well too. So we hope that you will reach out to us at nocd.com or treatmyocd.com and chat with our team, and let's see if we might be able to really get something going for you, right? Let's see if we can break through with that teletherapy for you. And not only do we treat OCD, we do work with hoarding, and we do work with body-focused repetitive behaviors, and we also work with tics. And if you've got a co-occurring trauma issue, we can help with that as well too with the OCD. So lots of options and opportunities for you here at NoCD. We also do one of my favorite things, our NoCD 411 sessions as well too. And in those sessions, if you're looking for some education about OCD and ERP, and we'd be happy to provide that to you as well. So check us out again at nocd.com, your online teletherapy platform for the treatment of OCD and related disorders. All right, let's check out what we got. Mr. Nice says hi. Hi, Mr. Nice. Christy says, been doing ERP for 2 months. It's helping, but your OCD is now trying to throw new themes at you to see what sticks. Well, it does that because it's a jerk, and that's what it does. The thoughts have really increased too. Am I doing something wrong? No, you're not doing anything wrong. In fact, I'd be surprised if this wasn't happening. I see this happen all the time. Once OCD realizes that we've got it on the run, it starts throwing some bombs at you, trying to see if it can kind of, stick its hooks into something and keep itself around. But no reason for that, right? No, we don't need to let that OCD trickery get us into something of that nature. So let's not let that happen. Also, any tips on how to stay patient with the process? You're seeing great results, but want to be further along than where you are now. I know this takes time, but how can you stay motivated? Thanks. Christy, I think the best way to stay motivated is to do an ERP exercise every day. If you wanted to be a great piano player, after 6 lessons, would you be disappointed, let's say even 2 months of lessons, that you weren't playing Beethoven? Or would you realize there is a process of learning this skill, and there are steps to go through to get myself to a point where I will be able to be a pro at this, right? Now, I don't believe ERP is going to take as long as it might to master playing some Beethoven at the Chicago Symphony Orchestra. But it does take time, and you have to allow for that time. And the best thing that you can do, Christy, is make sure that you're practicing between sessions, doing your ERP work, so that you're going to get the results that you want to get. That's what has to happen, right? That's what's so very, very important. Peter says, a year ago, I read a post on the internet about someone who claimed he had no thoughts and feelings. Well, I don't believe that, but okay. I'm sure your OCD does. And as soon as you read it, you started freaking out and panicking because you thought that you have the same problem. I became so convinced. Now, isn't it interesting? How could you freak out and panic about not having thoughts and feelings? Because those would be feelings that you were having there. But let's not get logical with OCD or anything like that, right? Even though that you could never freak out and panic without feelings. But a small little thing there, of course, right? You became so convinced you had this problem that you started constantly trying to come up with thoughts, and whenever your mind was blank, you would start panicking. But I'm going to bet you had a thought of, oh, my mind is blank, I need to think of a thought, which is a thought, which meant your mind was never actually blank. But again, small detail that we don't need to maybe focus on so much, or the biggest detail in the world to actually pay attention. Also, you keep feeling like your thinking process is wrong now. No. OCD would have never done that to anybody. I can't understand how that would happen. And you need to return it to how it was before. This problem has consumed my life and you cannot let it go. What shall I do? You're never going to get your thought process the way that it was before, because every day you're a different person than you were the day before, because every experience you have changes you in some way and leads you to be a different person. So therefore, the goal of going back to the same thinking that you used to do would be like saying, now that I've been through high school and college, I'd like to go back to thinking like a first grader, which you're not going to do because of all the extra knowledge that you have post first, second, third, fourth, and fifth, and so on grade. The notion that you could go back to doing that is probably something that OCD has told you is possible, but it tricks you and it's full of stupid trickery. So I would encourage you not to believe anything that OCD tells you as possible, as being sacrosanct in things that you ought to listen to and pay attention to. Because OCD sure does love to confuse possibility and probability and make you believe that once something is possible, it is now highly probable. And what absolute garbage that absolutely is. Can't think of a better way to describe it than that. Okay. So, Peter, what should you do? The opposite of everything that OCD wants you to do is what you should do. That's what I would suggest. That's what I want my patients to do, is the opposite of what OCD wants them to do. Otherwise, if OCD is so smart and wise and good, then everyone just do everything that OCD wants you to do, and you don't need me. And you don't need this webinar, and we don't need an OCD, and we don't need specialists in OCD, and we don't need psychiatric medications or anything like that. We need none of those things whatsoever, if that's the case. All we really need is to listen to OCD and do everything that OCD wants and believe everything that OCD wants us to believe. And then we would be okay, right? No. Millions upon millions of people have tried that, and none of them have reported that that made them feel better. None of them felt that that was the answer. You know why? Because it isn't the answer. It is not the way to feel better. It's the way to feel worse, but it's not the way to feel better. So you can do everything that OCD wants you to do, but you're only going to feel worse in doing so. Or you could do the opposite of everything that OCD wants you to do and have an opportunity of actually feeling better. I encourage you, Peter, to take that route and see where it goes. Terracotta Ciabatta. Love it. You've been working with a therapist for about 3 months. You've not done any ERP exercises because she wants you to distance yourself from your thoughts, such as seeing it as a movie playing in the background. However, it has occurred to you that you really don't know how to do that. She hasn't given me much to do in regards to that. What do you suggest I do with my thoughts? I suggest you do ERP. That's what I suggest you do. There's no reason to have this go for 3 months and play it as a movie. Do ERP. So get with your therapist and let her know It's time to do ERP. And if your therapist is not willing to do it, well, then you have some choices to make about if that's the therapist that you want to stick with or not. Okay. Leslie, Lady Hawk's Coloring Cave. Man, you guys and the names are fabulous, I got to tell you. Says, so glad you caught a live stream. Does a person have OCD from when they were developing in their mother's womb, or is it caused by life experiences or a mix or something else? Great question, and someday we're going to answer that. Right now, the best of our knowledge is that we all have genetic predispositions towards certain things and need environmental stressors to kick those off. The mix of the genes and the environment are probably what create OCD. That may happen very early in certain people. That may happen later in life for others. But I can't answer if, in the womb you have OCD. We haven't been able to talk to anybody in the womb yet. We've knocked on mom's bellies. No one's answered other than with a kick to our head if we're trying to listen. So we have no answers from them as of yet on that experience. Let's see. Ben or BH says, "Hi, Dr. McGrath. First of all, you're the real MVP." Oh, well, thank you, B. I appreciate it. Secondly, can you touch on how when you mentally check how you're feeling about a thought that it can backfire and make you more unsure and confused? Oh, yeah, sure. There's plenty of research out there that shows that checking actually leads to less confidence than more confidence in people. There are plenty of people who have checked and checked and checked and checked and hoped that in checking they would finally develop a 100% confidence. But what any of you who check things probably have found out is the more that you've gone to check things, the worse you've actually felt about them. And so what do? You check again. And then you don't get that confidence you were hoping, so you check again, and you don't get the confidence you're hoping for, and you check again, and you don't get the confidence, and you maybe understand my pattern here of what I'm talking about. If checking was really, really helpful, you'd only need to do it once or twice, and then boom, you'd be good. But because OCD is the doubting disorder, and it doubts all of the checking that you do, it doesn't matter how much checking you do, it's always going to doubt it. No, I've not yet met someone with OCD who's checked things enough to the point where their OCD said, excellent, we are now 100% confident in the checking. Congratulations, all is well. No need to worry about any more checking whatsoever. We're good, right? No. Eventually, people just have to kind of go without having that 100% guarantee in the experience. As annoying as that is for people with OCD, that's what they have to do, and that's how they have to approach it. So you're never going to check your feeling and understand how you feel about a thought to a level that will be satisfying to OCD, because OCD is the doubting disorder and doubts everything you tell it. And therefore, though it demands a certain answer, it can't accept that answer because it doubts it. It's paradoxical, right? You must give me this answer, but when you hand it to me, I will doubt it. And therefore, I'm going to ask you to hand it to me again. But when you hand it to me again, I'm still doubting it. So therefore, I'm going to ask you to hand it to me again. Oh, you handed it to me again, but I'm doubting it. I'm going to ask you to hand it to me again. And on and on and on and on. No one with OCD has gotten an answer that they've been 100% satisfied with. It just doesn't occur. Josh asks, have I seen cases where an OCD sufferer will take their testing behavior too far and end up in trouble or actually doing the thing they are afraid of? I have seen people who have tested themselves, and the only thing or that they've actually harmed is themselves, right? Not anyone else. I have still not had that happen, but I have had people who have done something harmful to themselves, not on purpose, but they did it accidentally, because they would test, what if I lean too far and then they fall over and bump their head or something like that. It's not gone to the point I've seen anybody die or end up in jail or anything of that nature. But I would ask all of you that when OCD asks you to test something, that you say, screw you, OCD, go to hell, because there is just no reason to test these things, because you're never going to test it enough to the point that OCD is satisfied with it. And no matter what you do in a test, OCD is going to say, all right, that was a pretty good one, but why don't we do a little bit more? Because it wasn't quite there. And then why don't we do a little bit more? And then why don't we do a little bit more? And then why don't we do a little bit more? Okay. You're never going to be able to test enough. So let's not try to test. Let's not play into the game of OCD. Let's not fall into the trap of OCD. Okay. Sunshine Bird says, hey, Dr. McGrath, I suffer from thought replacing. The more you replace the negative thoughts with positive ones, the more your mind yells at you. It's awful. How to not give in. How to trust this is OCD. Also, as a random question, any thoughts on microdosing psilocybin for OCD? Don't really have many thoughts on microdosing psilocybin. Haven't seen any controlled studies on it yet, so can't answer that one. But going back to the first one, you asked the question, how can you trust this is OCD? Which means you're going to want a 100% guaranteed answer that this is OCD, which, of course, I cannot give to you. And this will be very disappointing to you that I cannot give you a 100% guarantee that this is OCD. But that is the truth. And I do not lie to you on here. I tell you the truth, which is I can't promise you that something is or is not OCD. But I can tell you with a darn good likelihood when it is. And when I see questions like this, well, why would we have to replace a negative thought? What could a negative thought do? If you've watched me do this show the last few weeks, I've thought about, bombing my neighbor's house. I've thought about the ceiling collapsing on me and starting an electrical fire and burning me. I've thought about pushing people downstairs, thought about shooting my car off of a bridge. I've had all these thoughts, and I've replaced absolutely none of them whatsoever. I've made zero attempt at all to replace any of those thoughts in any way possible. So, Sunshine Bird, how dangerous am I? How dangerous am I for not having replaced any of these thoughts whatsoever? Because it seems that you're trying to tell us that if we don't, then we're going to be with negative thoughts, and that's bad. But I'm wondering, first of all, what's bad about a thought? And number two, I don't even like labeling thoughts as negative or bad or good or positive. I think a thought is a thought, and that's all that it is. When you get down this rabbit hole of having to explain these thoughts, you get in trouble, right? You really do, because then OCD is going to take things and label more and more of them. Label more and more of them as bad, as negative. Well, what is a bad thought? What is a negative thought? I don't know. Because if the thoughts I told you earlier were bad or negative, then I've just been spouting negativity and badness into the world in this webinar. And I've also asked the patients that I've worked with to allow those thoughts to be there and live with those thoughts and not do something to neutralize them. Does that then make me a bad person for getting people to be with bad thoughts? Or is there just no such thing as a bad thought? And why are we going to waste our time trying to figure out what is or is not a bad thought? I just don't even really want to go down that route with people because I see nothing good coming from it whatsoever, right? I don't spend time labeling my thoughts as good, bad, right, wrong, positive, negative. And I'd like to see all of you work on decreasing that as well too, because I just don't see it paying off for you as being a helpful experience. Joe says, please discuss potential therapies for relationship OCD, intrusive thoughts of a partner cheating. Thanks. Well, Joe, I always go back to good old exposure and response prevention therapy and try to get people to recognize that you are most likely having obsessions, as you describe it here, I'm going to bet, about a partner cheating. Or you have a partner with relationship OCD that is having those obsessions maybe about you. Well, either way. I could be wrong on both those, but we'll go with those. So, Joe, if you're having these thoughts about a partner cheating, yes, they are intrusive. They're uncomfortable. I'm wondering what the compulsions are that you're doing. Are you going through their phone? Are you constantly asking them questions about where were you and why did you do this? All those things. And is there a point where you just can't get an answer that is satisfying? For me, in these situations, what I like to do is a worry book in the home. And in the worry book, the person you have asked these questions to will write down the question. They will then write down the answer. And after doing that, if you ever ask them again this question, because it's a question that gets repeated time and time again, if you ever ask them the question again, they will point to the worry book and they will say, the answer is in the worry book. Please go and read the answer in the worry book. And they will not have a discussion with you about whatever reassurance question you may be asking about the relationship. Now, why would we do this? Well, number one, Joe, I'm going to bet you've asked similar or same questions over and over and over again. And though you get the same answer, you still have doubt and insecurity about it, so you want to ask it again. Now, why do we ask questions multiple times? Let's talk about this for a minute. This may be eye-opening for a few of you. We ask questions multiple times because our OCD is hoping this time we'll get a slightly different answer than we did before. Because once we get a slightly different answer than we did before, we could say, wait a minute, that's not what you said yesterday. Yesterday you said blah, 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 blah. Today you said blah, 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 blah. And I'm wondering why the different answer today than yesterday. So what I'm thinking we need to do is spend the next 1,742 hours talking about why there was a different answer today to the exact same question that I asked you yesterday. And I'll be very interested to hear what the reasoning was behind that. And I'm sure as you're giving me your answer, I'll come up with 9,483 more questions to ask you along the way. So this should take about a year for us to figure out. And we'll keep the relationship OCD flowing very nicely over the course of the next year. Now, that sounds horrible, I'm sure, to everybody. And yet, to OCD, it's not so bad. Seems fair. Seems decent. I mean, wouldn't it be best just to really get to the bottom of all of these answers? And yeah, it takes time. Yeah, could be doing other things like, going to school or work or working on my relationship and being positive and taking a vacation. Yeah, I could do all of those things. But hey, can I really enjoy all of these things if there's this one question that needs to be answered that's really sticking out there in the world and really just kind of getting in my way? And wouldn't it be best if I just had assurance about that? Because I got this feeling, if I get the answer to that, then all this other stuff's probably going to feel better. So, yeah, let's put the effort in. Let's figure it out. I'm in for the long haul here. We're going to figure out the unfigureoutable. And when we do that, then finally, when we get to that answer, we'll feel great. And then we'll move on to the next. There's only about 478 more questions to go after that. And then we'll have run through everything and we'll be great. Now, if we take those 478 questions and we figure 1,000 hours each of back and forth kind of discussion before maybe we let that one go, well, we're looking at pretty much the rest of our lives satisfying what OCD wants. But hey, at least on my deathbed, I can say, I finally figured it all out. And then OCD is going to say, well, funny you mentioned that. Yeah, you figured out level 1, but now level 2. And boy, what a shame you're on your deathbed, because there's an infinite number of other levels to go through before we figure this out here. So, well, doesn't matter that you're dying. Strap in, because here we go. Let's begin level 2. And it goes on and on and on and on and on. And wow, you just don't live the life you want to live. You live the life that OCD wants you to live. So, Joe, that's an amazingly long-winded answer to get to this point of, just because you have intrusive thoughts about somebody cheating doesn't mean that you have to go down any rabbit holes with them. And you could just say, my OCD does love that one. I'm going to have to start practicing moving on from it. Because going down that rabbit hole probably over time ends the relationship. And you might say, and I really loved that person, but OCD will say, yeah, but what if they cheated on you? So Matt says, hi, Patrick. Hello, Matt. Dr. Aurelius says, hello, Dr. McGrath. Hello, Doc. Kim says, tips on stopping rumination without thought stopping. Well, I would never suggest thought stopping, by the way, because it doesn't work. And I don't know anybody who does suggest thought stopping. And if you have a therapist who's suggesting thought stopping, please educate them on the fact that, and in fact, here's what you say to your therapist who's trying to teach you thought stopping. Ask them to stop thinking of a pink elephant and see how they do with it. right? And just keep talking about pink elephants for the rest of your session and see if your therapist can stop thinking of it. And if your therapist can't do it, well, how are they going to teach you how to do it? Right? So how do you deal with rumination is Kim's question. And the answer really is, well, you allow for the fact that your brain's going to run a script that you can then purposely run, take it out of OCD's hands, put it in yours, purposely run the script over and over and over and over and over again until you're so bored with it that it kind of falls out of your head. You know, the best way to get a song stuck in your head out of your head is to listen to it multiple times. So if you have this thing that you're ruminating on, instead of trying to stop thinking about it, why not do the opposite? Why not only think about it? In fact, I've assigned this to people in the past who are, like, oh, I can't stop thinking about this thing. Oh, really? Great. I want you to only think about that thing. I don't want you to think about anything else. And then we'll be going along in the session. They'll switch topics. Like, nope, no switching topics. You're only talking about that. And then about 2 minutes later, switch up. Nope, stop. Go back to that. And after a while, it turns out to be really, really hard to only focus on that thing. But in all their effort to not focus on that thing, that's all they could focus on. There's a bit of a paradoxical aspect to our brains in that situation. So that's what I want you to do. We are halfway through tonight, and reminder to everyone, you're listening to our NoCD webinar. We are at nocd.com or treatmyocd.com. We are a telehealth platform for the treatment of OCD and related disorders. We treat hoarding, we treat trichotillomania, we treat excoriation or skin picking. We work with people who have tics, we work with hoarding, we work with people who have trauma, along with obsessive compulsive disorder as well too. So if you're looking for help, and you're in the United Kingdom, or you're in Australia, or you're in Canada, or you're in the US, and here in the US you want to use your insurance, check us out because we're getting more and more insurance coverage all the time for people here in the USA. And you know what? We're taking appointments for June now. So please reach out to us at nocd.com and know this, that not only will you be supported in ERP therapy with your therapist who's trained to do ERP by my crack team of psychologists and therapists, not only will you be doing the ERP, you'll have support between sessions as well too that we can provide to you with good messaging, and you'll have access to the largest community of people with OCD in the world. And there's just so much more. So check us out, nocd.com. Leslie Lady Hawk's Coloring Cave says, I'm getting help with your counselor at NoCD. She's awesome. I'm so thrilled to hear that. That's wonderful. I love an awesome NoCD therapist. Mel says, you have your first session next week. Okay, you're afraid you're beyond repair, though. You have a really hard time doing exposures. Well, Mel, remember, we're going to do this gradually, right? We are not here to throw you off of your game. We want to throw you off the OCD game, but we want to keep you in the game of life, right? And so we're going to gradually do this with you, right? We are not here to throw you in the deep end of the pool. Please, Mel, give it a chance. That's all I'm going to ask. I'm so glad you have your first session next week. We really look forward to working with you. Emily says, early in ERP, catching yourself ruminating, researching, but find yourself doing these things again automatically shortly after stopping yourself. Any advice on stopping these compulsions in a way that sticks? Yeah, if you're researching, let's say, by going to your computer, put a little note on your computer. When you close it, you have to see it that says, what is the purpose of going on the computer now? And then when you open it, have another Post-it note or something on the top that says, where are you going and what are you doing, right? As reminders to you to put a stop, put a break in the experience and ask yourself questions. Am I doing this in service of myself, or am I doing this in service of OCD? In doing this, will OCD feel better or will I feel better, right? Those are the kinds of questions I want you to really work on asking yourself, Emily, and know that you're doing things because they're good for you and not doing things because they're good for your obsessive compulsive disorder. because we don't want to do things that are good for OCD, because that feeds OCD and that makes that monster bigger. We don't want that. We want you facing that fear, living with that discomfort, learning that you can handle that experience. Matt B says, the NoCD app is an absolute game changer for treatment worldwide. Thank you, Patrick. Well, thank you, Matt. And I can't take credit for the development of it. Our CEO, Stephen Smith, is amazing. And the work that he did to help people with OCD changes lives all the time. And we are along for the ride with Stephen to make sure that his vision is fulfilled. Here's a guy who had OCD and struggled for so long to find therapists who could actually help him, and instead met with people who gave him horrible advice like thought stopping or told him to move away from his family. And he followed all of that advice and it didn't help. And he was finally online and saw people talking about OCD and they were like his symptoms. And that's when he first realized, oh, wait a minute, that's OCD? Because he thought OCD was a personality quirk or, washing your hands or something like that. And when he finally got the help that he needed, he knew that it was going to be his mission to make sure other people got that help faster and more available and cheaper than he was able to do it. And that was the impetus of NoCD. So thank you, Stephen, for the work you've done. And again, it's amazing to be on the team with you guys. Terracotta Ciabatta says again, what ERP exercises would I recommend for constant list making and rhyming words, as well as constant researching for the perfect word that rhymes? You're obsessed with this. Oh, that's awesome. Not at all. No, that's not fun, I'm going to bet. Yeah. So, first of all, for lists, I've had people purposely remove things that they can make lists with if you're writing lists down, right? Like, if you're going to make a list, it has to be on a certain pad of paper, but that is locked in 3 lock boxes. And the pen that you can use, and it's the only pen that you can use, is in the car, or something like that. And just make it, again, put a bunch of steps into place that get in the way of doing it. And every time that you go to take another step toward it, maybe you have to ask yourself a question or two about, what is the purpose I'm doing this for? Am I doing this in service of OCD, or am I doing this in service of myself? These lists, I'm going to go with, sound like OCD. Don't sound like they're in service of yourself. So we don't want these lists being made because they're not actually helping you. Now, the rhyming, that's interesting. Is there a perfect word that rhymes with something? Like, what's the perfect word that rhymes with back? Is it jack or hack or lack or tack or mac or back? I don't know. And boy, we could probably spend a lot of time debating which one of those would be the best rhyme for that word. And the word perfect you use there, Terracotta Ciabatta, is interesting because what does perfect actually mean? Is it perfect for you? Because what if you think the perfect rhyme for jack is slack? But I think the perfect rhyme for jack is malback. Now, which one of us is correct? Because we both have our own idea of what is perfect. How do we know? How can we find out? Might we have to do what I try to get lots of people to do? Might we have to agree to disagree? But would that be satisfying to your OCD? Probably not. Probably don't like that. So then what do we do? What do we do? What do we do? What do we do? Boy, such decisions to make in this situation. Well, I think I would. You have the better, cooler name. I have the doctor in front of my name, though. Some people might say that's cool. Other people are like, who cares? Like my grandmother, who once said, well, you're not a real doctor, so so maybe the doctor doesn't matter at all. So I always use that doctor example. I play that up purposely to give that zinger my Graham gave you to keep me in my place. Yeah. So, when you're stuck on the idea that there is a perfect thing, you're going to keep searching for it. But because you have OCD and you have the doubting disorder, you're never going to actually find it, because you're never going to fully believe that it is perfect, because you're going to doubt everything if it is perfect or not. So I'm going to give you an exercise, Terracotta Ciabatta. If you find a rhyme for a word, afterwards come up with a word that doesn't rhyme with that word, and then pair those two things together and just live with that discomfort that you're ending on a non-rhyme. Okay. Try that as an ERP. See how it feels. I'll be interested to hear from you next week to see how it goes. Paula asks, why are therapists' knowledge about OCD so limited still? Why don't most know how to treat or identify it? A lot of it is due to our graduate system, I believe. You're going to have a couple of classes about mental health disorders, and it's going to cover all of them that are in the DSM, which means that you might spend a day on each one of them. And then you're going to go to some practicum sites. And if those practicum sites only specialize in one area, you're not going to learn about all the other stuff, right? Now, I could say that about myself. I'm woefully ignorant about many other mental health issues because I've devoted my whole life to treating anxiety, OCD, trauma, and doing ERP. So if you ask me about other conditions, I also will not know a great deal about them because I'm so singularly focused in this one area. So I'm not going to say that it's bad that people don't know about these things. But what I will say is this: when people come in and they have something and the person doesn't really know a lot about it or doesn't specialize in it, and they still try to work with it or treat it without getting any kind of consultation or supervision, that's where I have issues, right? I would never, ever treat somebody with a condition that I haven't been trained on, that I haven't done a practicum on, that I don't have specialized training in, or that I don't have access to a supervisor to go over the case with. It would never cross my mind to do such a thing. I would say to someone who came in my office, I don't specialize in this. I'm going to find somebody who does for you. Now, let's say I'm in a really rural area and I'm the only therapist for 100 miles. Well, it's time I educate the heck out of myself in this condition then, so I can start to really learn about it and to find someone who knows how to do it and try to get some consultation with them so that I can do what's right for the person that I work with. Paula, if everyone in our field did that, our field would be up 10 times more awesome than it already is. And I hope that that's the way that it's going to go for everybody. Stephanie says, your OCD makes you feel like a horrible partner for thinking other people are good looking. How do you tackle this? Oh, Stephanie, what's wrong with other people being good looking? I'm going to bet most people on here tonight who are dating or are married have thought that other people are good looking. And therefore, are they all bad people? I didn't know that once you married or were dating someone, you suddenly only had to think they were the only good-looking person on earth. Right? I don't think that's actually true. It's not that somehow I lost my attraction to other things. I mean, I've been married. I found other people attractive. I know my wife found other people attractive. That didn't have to mean anything, though, other than, oh, they're attractive, right? I'm wondering if, for you, OCD is conflating this and saying being attracted to someone is just like cheating on them, right? Or it's as bad as cheating on them. there's a little maybe thought action fusion kind of thing going on there. Thinking something is as bad as doing something. So if I think someone's attractive, it's as bad as going out on a date with them or something like that. And I contend that that's just simply not true. But OCD doesn't care what I think. So Stephanie, I want you to work on acknowledging and moving on. Instead of beating yourself up for the fact that you might find someone attractive, I want you to acknowledge, okay, that person has an attractive feature. Excellent. I am now going to move on, and I'm going to live my life and recognize that you can handle that. You don't need all the guilt that OCD is going to throw at you for that. Through His Blood Ministries had her first session today. Awesome. Congrats. I hope it was amazing. Logan says, I think my friend has OCD and keeps going to the ER because she thinks she has a disease that she doesn't. How do you help her? Logan, have her listen to this. This is going on YouTube. All right. So this will be there probably by tomorrow. Hello, friend of Logan. I hear that you keep going to the emergency room because you believe that you have a disease that has not yet been discovered or found, or that any test has said that you have. And I'm going to bet every time that you go to the emergency room and they do a test or run something, you get this instantaneous relief and feel better, but only for a little bit. And upon leaving the ER, you can start to feel that small bit of tension start to build again and again and again until it gets to a boiling point that you feel like you can't handle it anymore. So you go online and you do research, you ask friends, you ask family members, but maybe it's gotten to the point now that you've asked so many of them and you've researched so many things that you've memorized all the sites and you know the answers that everyone's going to give you, but it's just not scratching that itch. It's just not really kind of giving you everything that you want. And then you start to think, well, where would the people with all of the knowledge be? Oh, the ER, but I was just there. But what if something was discovered in the last few days that changes everything and makes it even better than what it was before? And maybe I'm missing out. So maybe it would be satisfying for me to go back there and to get another test just to be sure and to see if there's anything new that they could tell me. Friend of Logan, this is obsessive compulsive disorder. It is what people with OCD do. Friend of Logan, you are not going to find your answers in an emergency room. You are going to find your answers in a therapist's office, in working with someone to help you learn how to handle the discomfort that you're experiencing about your health and this idea that you have a disease. You can stay going into ERs over and over and over again if you like. That is your prerogative. It is going to cost you thousands upon thousands upon thousands of dollars. Or you can come and do therapy and spend fraction amount of that money and get the care that you actually need in order to help you. Now, I'm going to bet as you're listening to this, what you don't yet maybe know is OCD, but I'm going to bet is screaming at you in your head going, this guy's an idiot. He doesn't know what the hell he's talking about. Don't listen to him. He has no idea what we're going through. And now that I've said that out loud, there's another part of your brain going, damn, how did he know that that was happening in my head? Holy crap, this guy, get out of my head. Well, I knew it because it's what people with OCD do. And I don't like seeing people suffer with OCD. So my hope, friend of Logan, is this. You're going to listen to this and you're going to take a risk. And the risk is, instead of going to the ER next time, you're going to make an appointment with a therapist. And check us out at nocd.com if you're looking for one. And that therapist is going to help work with you on recognizing that these runs to the ER are temporary reliefs to an underlying problem that is never going to be taken care of by runs to the ER. And I hope that helps. Lametta137 says, hi there, doing better than last week today. My OCD is sticking to whatever I look at, or whether I look at my kids or not. Damn you, OCD, LOL, you say. But you're telling yourself you don't know if you're staring at them long enough. Well, you never will know, right? And we're going to have to just sit with never really knowing 100%. You're telling yourself maybe you don't know, maybe you're avoiding looking at them, maybe you're not, it's not going to let you get back to the task at hand. Good for you. You don't have to answer OCD because it is unanswerable. OCD has never accepted an answer 100%. It's not going to accept yours either. Matt B says, what existential tips or what good ERP tips would I talk about for existential OCD? Matt, I always talk about the idea that philosophers for thousands upon thousands of years have contemplated the questions that people with existential OCD ask, and their OCD says, yeah, it's fine that philosophers contemplated this for thousands of years and haven't come up with an answer, but it's about time we do have an answer, and you're the one to figure it out. So, Matt, you're either the greatest philosopher ever in the history of the world, or you have obsessive-compulsive disorder that's demanding something from you that is just not going to happen. So, Matt, my challenge to you is going to be this. Allow for uncertainty. Allow for discomfort. If OCD poses an existential question, instead of having to get an answer for it, say, that's interesting. Yeah, I'll live with that. I'm not going to try to find that out. I'm not going to search that out. I don't have to know that. That's okay. Right? And see where it goes. It could be, why are we here? What purpose are we serving? Those questions have been asked for time immemorial. They're going to be asked for infinity. I don't know that we're ever going to have an answer for those things. And even if one person or one religion or one faction comes up with an answer, it doesn't mean that anybody else is going to actually agree with it. So when you ask the unanswerable questions, Matt, you go down this rabbit hole that OCD loves, which is, well, they may be unanswerable, but damn, we're going to sure try, right? It'd be like this. Matt, welcome to McGrath University. We're so glad you're here and paying tuition every month. Just know this, Matt, you're never going to graduate. But keep coming back every month and keep paying tuition, because we are going to take all the classes. You're just never going to leave here, and I'm going to just keep making money off of you for the rest of your life. But keep coming back. It's really fun to have you. Jawar says, can OCD be cured? I never talked about OCD being cured. I talked about the fact that OCD can take a back seat. You can learn to live with OCD. You don't have to be ruled by OCD. You don't have to do everything that OCD wants you to do. And therefore, you can do the things that you want to do and not all of the things that OCD wants you to do. Because imagine doing all of the things that OCD wants you to do and then suggesting that to all of your friends as well, right? Well, I think all of them would probably be like, no thanks. I'm good. No. Do you ever go up to anybody who's having a rough day in your life and say, hey, it appears you're having a rough day. Have you considered some OCD? Right? I'm hoping not. Right? I'm hoping that would never be something that you would ever do. And I'm just going to bet that that's just not anywhere anybody would want to go. Right? So we're not here to hand out OCD on Halloween. Trick or treat. How about some OCD? No, that's not what we're doing. We're here to help remove the influence of OCD off of the lives of people. Because if OCD was really helpful, that would be my job. I would be giving people OCD. I would be making sure that they had plenty of it. But I'm not here to give OCD. I'm here to help people recognize that they can handle whatever pops into their head and that they don't have to go down the rabbit hole that OCD wants them to go down. Abba says, doing ERP myself right now after finishing treatment, but there are days that are so bad. You dream of your obsessions. Any suggestions here? Well, you continue to do ERP, right? OCD can pop up in dreams. I've heard that before, and then people want to read into that with some special meaning or something like that. But I don't put any special meaning into any dreams whatsoever, because I've had some really weird dreams, and then I'd have to put a whole bunch of meaning into all my weird dreams. And I just don't. I mean, I had a recurring nightmare from as a child for years and years and years. And in part of it, my grandmother's slippers came alive with gnashy teeth, and they would chase me. So, I mean, what should I think about that? And how much credence should I put into that? Because, hey, it was in a dream, and therefore it must be real, right? It must be true. It must be something that I want or like or anything of that nature. No. As far as I know, my grandmother's slippers never came alive, never chewed up anybody. And I was never attacked by them. But I sure had nightmares about what if it were to happen. So, weird things pop in our heads while we sleep. We don't need to give them any credence whatsoever. Gavork says, a comment from Reddit triggered your theme and you can't seem to escape it. You know it is irrational and trust advice from random people, or to trust advice from random people on the internet, but your mind has latched onto it and can't let go. One of my favorite things that I see in OCD is that random people, you have no idea who they are, become experts on the internet. Somehow, that person is the wise one. Stupid doctors, dumb family members, idiot friends. No, random Reddit person is the smartest person in the world, and only they truly know the answer to this. That is right. Thank you, random Reddit person, for absolutely knowing everything that I need to know. And I'm going to follow you now and listen to everything you say. These doctors, stupid morons. Family, idiots. Never going to listen to them again. You, Reddit man, are a real man of genius. That's right. You take all the cake. You get all the credit. Random Reddit woman, dude, Z, whoever, whatever, however you choose to identify yourself being on Reddit. You are the bomb.com. And you know it all. And I will lean on everything you type as if it is the greatest thing ever in the history of the world. Does that sound right, Gavork? Does that kind of sound like where your head has gone? Now, here's the thing. Could they be right? Sure. Could I be right? Absolutely, sure. Could 12 other people who have an opinion be right as well, even if all 12 of those opinions are different? Sure, absolutely. You know what one OCD likes the most, though, is the one that's closest to what OCD is afraid of. That's always the one that OCD picks. OCD never picks the one that's furthest away from what it believes. It always picks the ones that's closest to what it believes and says, ooh, Gavork, look over here. Hold on. Potential confirming information. Ah! Must be believed. Wisest being ever. So, please, everybody, recognize that OCD is going to make an expert out of someone who probably has less knowledge about OCD than all of you who have listened to this tonight. Okay? No need to go and believe every random thing that you hear or read, even though OCD will latch onto it and tell you it might be the best advice ever. Because I've not seen that ever work out very well for anybody. Well, you spent another hour with me. Thank you so much on your Wednesday night webinar here with us at NoCD. You can check out the NoCD platform at nocd.com. Sign up for a therapy session with us. We work in Canada and the United Kingdom, and we work in the USA with all sorts of insurances, and we work in Australia. And we've got appointments open for June now. So let's fill our people up, folks. Let's get you in. Let's get you seen. And let's get rid of that OCD. Because remember, what am I always talking about? What's my goal? I want you to live the life that you want to live, not the life that OCD wants you to live. All right. Be well, be good, do well, do good, and remember, OCD sucks. Good night, everyone.